All right, for those who are new, my name is Mildred. I am the developer and the consultant for the case-based surveillance system. We are looking at the screenings and management module of the system. And yesterday we looked at how to create a client account and how to retrieve the files for us to fill in information and record screenings for the clients. We use the case 1 from the case scenario. And you all have these cases for you to try out. We want to try using a different case today to look at how to use the system again, and then we're going to break ourselves into different roles and try to use a case that will make the whole screening more understood. We want to work with case 5 today, and I would like to have volunteers, if you don't mind, from any country. I want to have someone who is going to act as the midwife, somebody from the infectious disease clinic, one of the clinical care coordinators, and an adherence counselor or prevention social worker. So who is going to be our adherence counselor today? Lester, are you available?
I guess.
Yeah. So who is going to be our clinical care team? We have 2. I don't know if Dr. Peters and Dr. Nisbet are here, or anybody.
Good morning, Mildred. I am not able to open my account.
Yeah, I just reset your password to use user 123.
Okay.
So are you available for clinical?
Okay.
Yes. Okay. I don't know, is Dr. Nisbet here?
Yes, I am, Mildred.
Okay, so will you join Dr. Peters for clinical?
That's fine.
All right. So nurses, who is going to volunteer to be our nurse and midwife today? Sister Williams, you here? We don't have nurses here. We should have some. Andrea Williams?
Yes, I am.
Yeah, will you volunteer? And Nora Francis?
Yes, Mildred.
Yeah, so will you 2 volunteer to be our nurses today? So, all right, so I'm going to look at the...
I'm not a midwife, no, Mildred.
Is that?
This is midwife. I'm not a midwife. I'm not a nurse.
Oh, you're not a nurse?
To get a midwife, yeah.
Or a midwife. So who is a midwife here? We don't have midwives on the call.
We have 25, 35 people.
Another midwife. All right, so we'll just go along and any volunteer along the way. So we want to use the case of Josette. It will help us to navigate the system and look at the different parts of the system where we can enter records. Josette is a 15-year-old Form 5 student, and after not seeing her period for 2 months, she presents to the health center. A pregnancy test reveals that she is pregnant. Her last LMP was 13 weeks ago, and this is her first pregnancy with no history of chronic medical illness. A family history of diabetes and hypertension, no surgical history or medications. She presents with a mild, non-productive cough. Her HIV and syphilis screenings return non-reactive. Josette breaks up with her partner and father of the baby, Philip, during the pregnancy, and has a new boyfriend named John. About 3 months later, gestation age at this point will be 26 weeks, they go for screenings since they have both become sexually intimate. She now presents with a mild rash on the palm of her hands and is a bit more tired at the end of the day. Her serology results shows that she is HIV positive and her RPR or VDRL reactive with a titer of 116. Other results include HTLV1 negative, TPHA was reactive, hepatitis B surface antigen was positive, hemoglobin HB was 9.8, HB electrophoresis shows that she is AA, blood group A with rhesus null, vaginal swab positive for bacterial vaginosis, and endocervical swab negative. Her 25-year-old partner John is also HIV positive and syphilis positive. The RPR was reactive and he has a titer of 1 in 128 and positive for herpes. On ultrasound examination, it was revealed that the fetus had a gestational age of 25 weeks and 4 days. A fetal heartbeat of 140 beats per minute with no congenital defects. Josette has had her entire course of immunization at birth. She is treated for syphilis with 3 weekly injections of penicillin. She is immediately started on antiretroviral therapy. She is given the standard single tablet combination of TDF, FTC, BFV. And as a policy for all antenatal clients, the clinic tested Josette for HIV drug resistance with a genotype test. So the clinical team will decide the treatment outcome, including her CD4 and viral load, plus we are going to look at the PMTCT intervention that is given. She later had a vaginal delivery of 7 pounds baby boy at 39 weeks gestation. We'll also discuss, or the clinical team will decide, the baby's outcome, the interventions, the screenings, and the immunizations. When the infant was 7 weeks old, Josette brought him to the clinic for his first infant checkup. He was asymptomatic. There, his AZT medication was stopped. He was continued on Septrin and given the second DNA PCR test. Josette continued her HIV care at the clinic. A HIV drug resistance test results returned showing that she had a K65R and K103N mutation, which made her first-line regimen inferior. She was subsequently switched to second-line AZT3TC. Her follow-up STI screening showed that she was positive for chlamydia, and she revealed that she had made up with her child's father, but was still seeing John. Given her risk behavior, she was given a risk reduction plan. She listed her baby's father as a contact for provider referral screening and testing. So we have plenty of information to walk through the entire system with this case. We want to start by, she has never been to the clinic before. We want to create an account. And then we want to register the pregnancy and do a whole antenatal follow-up. And then start registering all of these different screenings and partner screenings. So let's start. Sometimes the reason we are using a case like this is in the event you are entering past records, it's easy for you to read the entire case and know how to fill the information in the system without having to think about it in a complex way. So the first thing we want to do is create an account for Josette, assuming she doesn't have an account. So we'll go to our login as a tester. And then we want to start with create new client account. So we use today's date and the contact of reporter, facility type. Let's say this is a public health clinic, and she came to the health center. Then the first name is Josette. There's no middle name or last name in the scenario. You can put unknown or make up one for the purpose of the scenario, but in real life situation, you don't make up, you just put unknown. So the date of birth, she's 15 years old, and that means that she would have been born in, what year is that? 2019? No?
2009.
2009.
2009. So she was born in 2009. Let's say 1st of January, since we don't have the day and the month. She is female. Her mother's maiden name is not known,
No.
and her testing code is generated automatically. Let's use her testing code, or let's generate a unique ID for her. So say JUU 09. Okay? And let's make it.
JUU.
Okay, unique ID type, let's say order. So now we have created the account. We want to request release of. Today is the 15th of October. And the unique ID is JUU 09A. Type of screening, we're going to screen for everything. Okay, so now we are here to collect information.
Mm-hmm.
She has not seen her period for 2 months, which means that this is October. She has not seen her period since August, right? And she came to the health center. So the first thing we would want to do is a pregnancy test. If we do it at the health center, or if she comes to the lab, right? So we're doing other screenings, and we don't have it on the list. Pregnancy test. I can add it now for us to just.
We should add it, yes.
So Mildred,
Yeah.
in the previous case where I did not have Hep D, I could have gone in and added it.
Yeah, if you had the administration room, we can add it. But I'll just add all of the screenings we need to do. But in your live servers, all the screenings are there. It's just that when we were configuring this, we just didn't add everything. We had screenings for, let's say, chlamydia. The screening here
Syphilis.
What other serology do they do for pregnancy?
Hepatitis B.
Is this surface antigen or with another side?
Oh, okay.
We do RPR, but one was positive, so I don't know if you have to add it here. RPR.
Yeah, it's already there.
Okay.
Then we do
Urinalysis. They do urine tests as well.
urinary.
For the pregnant.
Urinalysis, and we do stools for OCP.
Okay. What's the test again?
We also do a high vaginal swab for CS.
So you use the same vaginal swab for every other thing. But you don't do pap smear for pregnancy, right? But we'll do for postnatal. Understood. Which other one? For those on arts, you use the urinalysis will not give you. Let's just write it born urea. Okay, I think this is everything we need to add for now.
Although Mildred, in the private facilities, you'll also find the touch screen, so they will do things like toxoplasmosis, a toxo screen, CMV, cytomegalovirus screening. We also have herpes. Well, herpes is there already.
Which one? You said one before herpes?
CMV, cytomegalovirus, CMV screening. And rubella for measles. Okay.
All right. So we have all of that. Okay, so now we have the screenings. She came in because she has not seen a period for 2 months, and she has a mild non-productive cough. The screenings at the health center today is for pregnancy, and then every month it is. Let's say result is positive, and it's today. Save this. We also screen the amount of tests, right? I don't have the results yet. And now, based on this case, urine test was done that was positive. Do you usually confirm pregnancy tests? Most of the time, the urine is always correct, right? Or do you send blood samples to the lab for confirmatory tests for pregnancy?
Not really.
Not really. All right, so we do the urine test, it's positive. Now, on this system, now what we looked at yesterday is that we fill in the personal information, we fill in the risk behaviors, comorbidities, HIV, TB, syphilis. Because this person is pregnant, you don't fill in the HIV, TB, syphilis screenings. We come to the personal information and make sure that it is up to date about the person. So for a pregnant client whose primary purpose visiting the health center is the pregnancy, or to find out if she's pregnant, or she has been there and you later find out she's pregnant. You are focusing on the personal information, the risk behavior, the comorbidity. You're not filling in the other tabs, and then you register the pregnancy. So let's start from the personal information. Her date of birth is 2009. Let's say she was born in Antigua and she lives in, let's say she lives in Dominica now. And her address here, let's say she's first name. Also, the town is the Health District of Wellness Center,
St. George.
We just use the name of the country for this one. So length and time in the country of screening, let's say she came when she was 10 years old, so let's say she's 5 years. She identified as a female, clinical orientation, respiratory syndrome. And the she has 2 boyfriends, they are male, so we assume she's heterosexual based on the story. Marital status is single. Ethnicity. We don't know what the ethnicity is. Make up one here. But on your life server, you don't make up, you use unknown. Occupation is she's a student, she says she's 1.5. The highest level of education should be primary because she has not completed the secondary. Number of sexual partners here from the story is 2 to 4. But at the time she came, she has her baby father as her only boyfriend then. And so her number of sexual partner then is 1. Type of sexual activity, we know vaginal is there. We don't know about oral or anal. It is not stated there. Is the client currently pregnant? Yes. Has the sexual partner been tested for HIV? No. Is alive? Cause of death is not applicable. Has left the country. So let's look at the risk factors or the risk behavior. Today, the 15th of October 2024, had sex with males in the last 12 months, had sex with females. Let's say, will you ask a 15-year-old most of these questions, or you just write not applicable because of their age? I mean,
she would have to come with her parents.
She have to come with her parents.
Yeah, because it's 15.
But then will she actually? Well, I know in some countries, once the person is pregnant and is a minor, it's automatically upgraded not to be a minor anymore. So you don't need their parental consent at the point of pregnancy.
No, in Dominica, they still need.
They still need, okay. And so in that situation, will you ask this kind of questions? Or I also know in some countries there are questions that you don't ask the minor, you just keep.
In the person of their parents, I believe they ask him.
They ask, okay. So let's say.
So let me just give a. So for example, Mildred, if a situation like presents itself, and you already gotten consent from the adult to do whatever you're supposed to do for the patient, personal questions that you're asking don't necessarily need to be in the presence of the adult. So you can ask them.
Okay.
Because they are risk. You're looking at a risky behavior. So once I get the consent from an adult for an underage child, the discussion now is between myself and the child.
Okay.
So you can ask them.
All right. So let's say we're asking the questions. Had sex with females, and she says never. Sex with persons of known HIV positive status. Let's say she doesn't even understand that. So we'll say no. Had sex with sex workers. Let's say she also doesn't understand. Sex for drug. Sex for drugs or material gain. Let's say she said in the last 12 months, she says John used to buy her ice cream every Friday. So shed needles while injecting non-prescription drugs. She says she doesn't even understand what we're talking about. Crack cocaine or other illicit drug use, she does not understand. Had sex under the influence of drugs or alcohol. Had sex with multiple partners. She said yes. Had perinatal exposure to HIV. I say yes. Ask the client if they have been exposed to HIV during the period of year. Yes. Received transfusion of blood or blood products or clothing factor. Never. Had occupational exposure. Not applicable. Been a victim of sexual assault. Let's say she said yes. Receive a transplant of tissue or organ or artificial insemination. Confirmed diagnosis of STI at the time of HIV testing. Confirmed diagnosis of TB. Had contact with confirmed TB. Been previously diagnosed with HIV. Condom use. She doesn't even know what a condom is, so let's say never. Is the client incarcerated or has a history? No, never been homeless, not a sex worker, and doesn't know what a transgender is. So we save. Comorbidities. The story says she has no surgical history, no medication, no history of chronic medical illness, but she has a family history of diabetes and hypertension. So we will use diabetes, no. Alcoholism, let's say no. Let's say she's malnourished. Let's say she looks like she was wasting. Reason for test, let's say possible exposure. ANC, no. Previously diagnosed, no. And previously, no. Unsafe. Now we are done with collection of reporting information, personal risks and comorbidities. We did the other screening. We have seen that she's pregnant and the mantle test is awaiting results. We'll read the results in the next 2 to 3 days, right? Now she has said that her last menstrual period was 13 weeks ago, and this is her first pregnancy. So we want to come to, so after personal information, risk behaviors, comorbidities, you are coming to new pregnancy registration. The date of the registration. So I'll explain how the system works with pregnancy. You have the unique ID of the client as the main file. Within that file, you register pregnancy. Every pregnancy is associated with a particular account, a unique ID. So one particular unique ID can have several pregnancies of the same person. So if the person is pregnant this year, in 2 years' time the person is pregnant again, for every new pregnancy, you register the new pregnancy. So the system has the history of all the pregnancies and all the activities, labor, delivery, and everything about the baby and postpartum on the system. So it's easy to see previous histories. And at the point where you need to enter previous pregnancy history, the system automatically pulls it out from the previous pregnancy without you having to enter it again because it's already there. So register a new one. And for pregnancy ID, like we suggested before, you can decide to use the number of, so if this is the first pregnancy, you can put 001, second pregnancy 002, depending on what you want to do within the country. So what I'll do is I'll use the unique ID and then I'll use 001. So I'll know this is the pregnancy ID. You can only retrieve the pregnancy record with the pregnancy ID. The pregnancy ID must be unique. So for us to know what it is, so people don't have to be memorizing their IDs. Once you know the unique ID, you just suffix it with the number of the pregnancy. Let's even use 01 because I don't think anybody will have 3-digit number of children. Okay, so the date of last normal menstrual period. It says that she had not seen her period for 2 months. Her last menstrual period was 13 weeks ago. So 13 weeks prior to today is what? Let's see.
So there's a major quick question. Well, there's a comment. So for every country, we have to have an across the board pregnancy ID number, because it will mean that if somebody goes to a different site, their pregnancy ID should be able to come up. So the same way that we use the unique identification code for our client who's on an HIV test, every country has to have the unique pregnancy ID. So
yes.
If the person goes to a different testing site, that the pregnancy will come up.
Yes.
Okay.
So 13 weeks prior to today is that will be like 23rd of July. So let's say last menstrual period is July 23rd. Then the telephone number, let's put she doesn't have, so we'll leave that blank. The pregnancy father's name, he said the name is Philip. We don't have the last name of Philip here. The occupation of Philip is a student like herself. The contact of Philip is just put a random number. On her emergency contact, let's say we put her mother's phone number. And then we register the pregnancy. So once a pregnancy is registered, the system creates all the files that are needed for the pregnancy. The antenatal visit forms, the encounter forms for every antenatal visit, the postnatal form for when the delivery has happened, the birth registration form for when the child is born, the risk assessment form, the pregnancy risk assessment form, the enrollment information forms, and it now generates flags about the person's risks of pregnancy. By definition, or by CDC definition, pregnancy is high risk when the maternal age is 35 and above, and when the maternal age is 17 and below. So we use that standard to generate risks, the risk flag for the pregnancy. Once you fill in a registration, the antenatal maternity routine follow-up is now populated with that file for the pregnancy until there is a record that the baby is born. It gives you a flag for HIV screenings for the pregnancy, a flag for syphilis screening, then automatically calculates the gestation age based on the LMP that is recorded, and then below you have other flags for the pregnancy risks. It categorizes the maternal age risks and BMI risks and different kind of medical risks that the pregnancy might have had, that the pregnancy might have based on the personal information. When we fill in the risk assessment here, then it will generate more risks based on the answers to the risk assessment. So I will go over the process again. For a pregnant client, you create the account. If the account doesn't already exist, if the account already exists, you retrieve the account. You fill in the personal information if it has not been filled before, or update it if there are changes. You fill in the risk behaviors of the person, and then you fill in the comorbid factors of the person. You now come to New Pregnancy Registration tab and register the pregnancy. The form clears out. Once it's registered, you have a form to register a new pregnancy in the future. Once you have a success message, you come to the antenatal/maternity routine follow-up tab, and then you find the file where you can record all the activities of the pregnancy. Now this follows all of the rules for the EMTCT validation, where it will look at the date for HIV screenings, or see if HIV screening has been done and generate a flag for it for syphilis, and also generate other flags for the risks of the pregnancy. The left side gives you all of the information according to the OECS guidelines, and then the right side gives you different tabs that present forms at the bottom when you click on the tabs. So let's look at the enrollment information. The first time you register the pregnancy, there are several tabs you need to fill. You need to fill the enrollment information. You need to fill the risk assessment information. You need to do the pregnancy HIV screenings, the syphilis screening, the TB screening, the hepatitis screening. Any other routine screenings that you do for pregnancy will be done here. And if there are immunizations that you need to give or vaccines, you give the record here. If the person is at high risk, then the partner screenings are here, or recorded here. And every antenatal visit going forward, after all of this has been filled the first time, you only need to use the new antenatal visit form to fill in information about the antenatal visit. So let's start from the enrollment information. So the date is 15th of October, 2024. All of the information we have filled in previously are retained here, so we don't have to fill it twice. So you just need to look through, and if there's anything that has changed, you can change it here. If not, you leave it and go further. We want to collect the baseline information for Josette, sorry. Her weight, let's say we feel she's malnourished. Let's say she was 82 pounds. Her height, let's make her very malnourished. Let's say she's very tall. Let's say her height is 176 cm. And then the BMI will be calculated automatically. BMI of 12, is it malnourished? No? It should be, right? Of course, in the house. BMI of 12. Is it a good BMI?
No, it's not.
So we'll put her, we want to make her malnourished, so we'll say her BMI is 12. The date of last delivery, she's never had a child before, so there's no need to fill this information. If she has had a child before and her pregnancy was registered on this system, this will be automatically populated with the last pregnancy event. The date of last normal menstrual period is filled in automatically based on what we filled in during the pregnancy registration. The expected date of delivery is automatically calculated based on the LMP. And so we have it as 29th of April 2025. The relevant family history, she has a family history of diabetes and hypertension. So family history, high blood pressure, yes. Tuberculosis, no. Diabetes, yes. Twins, let's say no. The case did not give us anything about her allergies, let's say no, non-allergy. And has the client ever practiced family planning? We'll say no. So previous obstetric history, she has never had a child before, so there's no need to fill this. We'll just update this. So we'll come back to the tab and go to enrollment information. So we have all of the values filled in. We'll go through it and see that it is correct. And then we come to the risk assessment. Now the risk assessment is not the same as the HIV screening risk assessment. This is the pregnancy obstetric risk assessment. So we want to look at the behavioral risks. Tobacco use, let's say she doesn't. Less than 2 years since last pregnancy does not apply to her. Substance use does not apply to her. Psychological risks, let's say adolescents. Let's say they have inadequate finances. Less than high school education, malnutrition, and let's say these are the psychological risks that she has. Medical risks, she has no medical issues. Obstetric risks, she has she doesn't have any of these. Let's see. The first time she was registered, she had no HIV and syphilis were non-reactive. So filling that test, so she has no obstetric risks. And so we update. Now, based on these risks we filled, the flags will now be generated. Like the BMI is less than 20. We'll have to take note of the weight gain and categorize the risks of the client. We have to do the pregnancy screening now. The first screening on the first day she presents today is non-reactive. We gain so this will tell you, this registers the gestational age at the time of screening. So if there are rules at the different gestation age where screening should be done, then you will be able to see this and keep to the rules. Then the flags above will change to say that last HIV screening, the date of the last HIV screening, and the gestation age at the time of screening. So if this person comes back when she is 36 weeks or thereabouts, you might want to screen again because of the last time the HIV screening was recorded. Now, if you record the HIV screenings here on this tab, it is not going to generate a flag for the antenatal. So you want to make sure the screenings that are done for antenatal is recorded under the antenatal record. Then we'll do the syphilis screening. The scenario said that the first screening was non-reactive also. So she had a syphilis screening. Let's say she did a VDRL and the result is negative, or let's say non-reactive. So now we've done the screenings. We did a mantle test and recorded it under other screenings because at the time she was doing the screening, she did it with the pregnancy test. So now, assuming that result comes out with an induration that indicates reactive, this is the time where we want to do whatever standard TB test that needs to be done here. But this does not talk about tuberculosis, so we're going to skip that tab. But you have the pregnancy TB screenings here for you to fill in the screenings for TB. Now the hepatitis screening is also needed. So we'll fill in this. And then we're doing hepatitis B surface antigen. The result here is negative, and we'll put the date. Then we see all our flags are now blue. So when you see blue and green for the flags, all is well, everything is up to date, everything is kept to the standard it's supposed to be. When you see anything in pink or red, then you know that an action needs to be taken. Now we want to do other routine pregnancy screenings that is usually done. So let's do the routine screenings. We want to do screenings for rubella, breast. Now let's be awaiting results for all of it. We want to screen for the scenario said that the HB electrophoresis was also done. And then it's returned AA. Okay, this was at 26 weeks. So at this point now, all of the tests are negative first. So let's say we've done all of this the first time. She has an appointment to come back another time. Let's say in the next 2-3 months, she's had an appointment to come back. Now she comes back for another antenatal visit. I'm going to log out so that you'll see how you go back to the file on a different day. So on a different day, you still log in as someone with a screenings and management role. And then you will come to request release of client's file. You enter the date, and then the unique ID. And then you come to collect information. Now, once you get here, you're coming to the antenatal/maternity routine follow-up, and then you are going to come to new antenatal visit. So the next time the person comes, the tab you want to focus on is the new antenatal visit. You can review the enrollment information if anything has changed, the risk assessment if anything has changed. You can look at the last HIV screenings if she's due for a new one. Look at the syphilis screening if she's due for a new one. Or you will visit this tab in case her risk has changed or she now has a new sexual partner. So we go to new antenatal visit, and now this is where I need the help of the midwives.
So Mildred, that's a quick question. So 2 things again.
Yeah.
So it would mean that, for today, for example, you're working at the 15th of October 2024. So you put, so if she comes next week, it means that I'll put not the current date, but not the date that she had the last visit, right?
No, the new date, the current date. So if she comes next week, let's say she comes on the 24th of October, the date will be 24th of October.
Okay. And then we may have to probably again put the unique code probably on the pregnancy lady's card, so that when they come again, you have that unique code for their pregnancy. Yeah.
Yes.
Yeah, because it has to be stored strong, because you're not gonna be able to remember unique codes for your clients. So you must write it somewhere on the card. So if they probably have a difficulty, like as we say sometimes during hurricane season, their next visit might not be in the same health facility, maybe in another one. I guess they will have to have the code to get the correct information on the system, no?
Now, once they have their unique ID, anybody who logs in can easily see their pregnancy ID on their account. Yeah. So the unique ID is what is most important. The pregnancy ID can be retrieved once there's a unique ID.
So repeat that. You said the unique ID is the most important thing. The pregnancy ID will come up if you just looking for information and use their unique ID.
Yes. So here we use the unique ID. We go to this page. If you click on antenatal/maternity routine follow-up, the pregnancy ID will show.
Okay.
Yeah. So here, let's say this is another week, another month. Let me say this is the 1st of December now, 2024. And unfortunately, we can't edit the gestation age because the system calculates the gestation age based on the last menstrual period and the current date, not the date of record you put here. So let's assume that this gestation age is now 26 weeks old. This will be like January 2025. Let's say this is January 2025. No, we don't have 2025, so we can't even go forward on the system, which is supposed to be the standard. But for this scenario, let's just use today's date and assume it is January we are using. Okay. And at this point, the gestation age is 26 weeks, but we can't edit this because the system is supposed to give us the accurate one. And we're just trying to go forward in time to do the scenario. So somebody should give me what the fundus height should be at 26 weeks.
It could be 23 because she's malnourished.
Okay, 23. And the presentation and position, what will we put there?
Cephalic.
The what?
Cephalic.
Well?
She said cephalic.
CEPHALIC.
Oh, cephalic, okay. The relation of PP to Brim. We'll skip that. The fetal heart.
Not engaged.
The date of,
relation of the PP.
Okay, this one not engaged.
Fetal heart 136 beats per minute.
Okay, the date of first fetal movement.
20 weeks. Or 18
weeks. So let's say the fetal movement we'll just keep using today's date because everything about dates we can't really manipulate to go back or forward in time. So let's say it happened at 18 weeks, but we can't manipulate that date. Edema is her feet swollen. She's having swollen face. Let's say Neil or yes?
No, none yet.
Okay. Her HB at this point is 9.8 according to the scenario. Urine ALB.
Urine.
So what will be the ALB and the sugar?
Put 1 plus.
And then the sugar?
0. Nil.
Nil.
The blood pressure?
114/64.
The weight is, let's say she's gaining a little weight now, right? She was, let's say she's now 90 pounds.
But Mildred, with this here, our initial weight was in kilograms also?
Both pounds and kilograms.
Oh, it was in both. Okay.
So we can actually put it in pounds.
So if our initial weight, for example, was in kilograms, and we put this in pounds, the system would automatically convert it to kilograms?
Yes.
Okay.
So headache, does she have headache?
No.
Yeah. Is having bowel movements in the bowels?
No.
Maturation?
Normal.
Discharge? No. Very Scott's bean. So special observations. So this is where you type in any observations that you have about the visit, if she's looking pale, if she's anemic, anything you want to write there. If she has scars on her body, like signs of abuse, whatever you want to write here. Okay? And other notes. Now, if she's high risk and she's having an OB, see her. This is where we do the OB assessment, will be recorded. So at this point, you do the PRT axis and all of the head, ear, nose, and throat, the hair, the skin, the breast, the lymph nodes, the heart murmurs, and all of those parts. So let's
Mildred, I think she had a discharge because she had, is this for today? She had a bacterial vaginosis. I think she had a discharge.
Yeah. Okay. And then observations, you put this in if there are things you need to write in here, other notes. Let's assume we have an OB assessment here, and we're looking at, so give me values for any of these. Skin, what value should I put for the skin?
Malnourished.
The skin should be what?
And pale.
The hair should be
dirty.
Is that?
Unkempt.
Any observation with the head, ear, nose, and throat? Head, eye, ear, nose, and throat. No?
Normal.
Thyroid?
Normal.
Breast? Normal?
Secreting a little cholesterol.
Well, I can't hear you.
Secreting cholesterol.
Secreting?
Cholesterol.
Cholesterol?
Cholesterol.
Oh, cholesterol. The spelling? Nope. That the spelling?
Cholesterol, yeah. COLUS. Yeah.
Okay, lymph node. I say normal.
Normal, yeah.
And the heart, normal.
Normal.
Lungs,
Clear.
abdomen,
Pregnant.
So the pelvic exam. You normally do pelvic exam at every antenatal visit, right? No?
No.
Okay. Rectal. Let's say all of these parts.
She didn't have what?
You said?
Didn't she have what?
No, she doesn't have what in this scenario. She had rash at the palm of her hands. That's the only thing she had, and then she had a vaginal swab that was positive for bacterial vaginosis, and her endocervical swab was negative. Okay, I think I will save this one, and then we will have the screenings again. So because at this visit, she was screened for syphilis, and her result was now reactive. Her VDRL was reactive, titer was 116. So she had a VDRL of, and this is reactive. So the dates are the only thing we are not doing correctly now, because we can't manipulate the dates. It has to be the current. It has to be the dates, like the dates that the client presents at the clinic. And if you're entering past records, then you can now enter the LMP. Like when you are registering a pregnancy for a past record, once you enter the LMP that already shows that the person has already delivered, then you'll be able to manipulate gestation age and the rest. So once we have a positive VDRL, we have a new RICS here that says that follow up with confirmatory test, because there is no confirmatory test. So we'll do the CPP. The result is positive. Okay. And then we have to do the HIV now is also positive. And then we want to have the confirmatory test. So now we have looked at the second visit where her HIV is positive, VDRL is reactive. She also did other screenings that are HLB1 negative, She also had hepatitis, now is positive. I don't have that here. I thought I added it. Yes, so let me do the HB electrophoresis first. So the hepatitis is positive now. So from the surface antigen is now positive.
Everything positive.
Okay.
I was saying almost anything. Almost everything is positive.
Yes. Only the HCV was negative. So she has the blood group. We didn't even actually put that there. Blood group is A, the rest is no. Vaginal swab is positive. Let me just write this. The lab knows how to write it better. Okay, so I think we've recorded all of our results, and we can now see her risks will be updated based on the results that she has here. So now that she's pregnant and we have a positive result, what the system has done is to automatically refer for PMTCT. Also, you need to, at this point at the health center, refer for care and management. When you have a client who is not pregnant and the person becomes reactive or positive, and you are referring, you want to use the referrals and you refer new HIV case for care registration and management. If the client is not positive for HIV, but is positive for the TB screening, you use refer new TB case for treatment and management. If the client is not positive for HIV, not reactive for any TB screening, and the client has a high risk behavior, then you want to refer for other treatments and management for preventions for any other STDs and for hepatitis. This client is pregnant and is positive for HIV, so we only do the referral for HIV. All other referrals are automatic. So you put in the unique ID. And then the category is, so now at this point, it depends on the country. What category will you place a 15-year-old pregnant client? You want to put the person, normally put the person under pregnant because there's a conflict between whether pediatric or adolescent or adults or just use pregnant. Now you've done the referral, you can now direct the clients to go to the care and management clinic. So the health center at this point, apart from when they come for other antenatal follow-up visits, you are done for the day. If they come back next time, you request release of client's file, collect information, and fill in the new antenatal visit forms. If there's an update to their risks, you can update it. Now that the referral has been done, we will go to care registrations and initial evaluation. For those on the clinical management team, you have this permission. If you look at HIV care referrals, you will see that on the list of those that has been referred. You will see the category, the date of name of referral, the date of referral, the date of birth of the client, and then the biological sex. When you want to register this client into care, you'll come to HIV care registration. We have the HIV, syphilis, and exposed infant and hepatitis exposed infant registration. This is where you register any exposed infant. We're going to look at exposed infant case tomorrow. You want to register adults, adolescents, and pediatric and pregnant here under HIV care registration. When you click on this, you can copy the unique ID to make it easy and click on that. So at this point, the job at the health center is done. This functionality now for care registration and initial evaluation is now at the management facility where you have referred the clients to. So you fill in the date and then you click on register. Once registered, you get this message and then it will refresh and you can now go back to care registration to see all of the registered clients to make sure that it is on the list. This person has been registered and the date of the month and year of registration is here. The month and year referred is here and the registered date is there. Now you want to do an initial evaluation. But before we go down to the clinical management, I want to hand over to all our volunteers to take over how we are going to manage this. First of all, there are cases in the scenario that talks about her having a new sexual partner, where she got the HIV and syphilis from. Then going back to the baby's father, the old sexual partner also, while she was positive. Then we also have a case where the baby was born and all of the treatment that was given. So Lester is here. You're still here?
I'm still here.
Okay, so now, are you able to share your screen to do the treatment plan? Or to do the prevention plan, sorry.
Alright, so let me share my screen.
Yeah.
Okay, so I need to sign in into my account, right?
Yes. Yes, you need to sign into your account. Go to the person icon at the top. Yeah. Go to home. That one, yeah. Okay, now let's assume that this is a new clinic that the person has come to, right? You want to request release of client's file. Go to general population here.
That's it now?
Yes.
Okay, just JUU 09 October, yeah?
F09F.
Yeah, 09.
The October is an not letter 0. Not the number 0, sorry. Okay. So it's correct. You've done it correctly.
It's done?
Yes. Is this the success message?
Yes.
Yeah. So you go back to collect information now. And then enter the unique ID. Now, instead of coming to this part, right? Easier when you expand your pages menu.
Expand?
Yeah, this pages menu. And scroll down, and I'll show you. You see where you have, scroll down, prevention and control / PMTCT. It's just, don't click on that. Don't click. You see, it's easy for you to just start your risk reduction plan from there. But sometimes you want information about the client's last visit, the screening results, and everything to guide your risk reduction session, right? You want to read it from here, and that's the reason we came to this, for you to be able to review the information of the person. Now, at this risk reduction clinic, this person has said that they now have a new sexual partner. So the risk history is going to change. So you scroll down. And then you can come to risk behaviors tab. You can fill out a new risk factor form during your risk reduction plan. So now you want to ask the questions and fill the information based on the scenario. The information already here. Anyone that has changed is what you update.
Okay, so let's go. She says she has a new partner, yeah?
Yes. So you put in the date. You don't need to fill that in if it's still the same answer.
Oh, I don't need to do that again?
If it's the same answer, you don't need to change it. You just go down, go through it. If it's the same, you don't need to change.
But then let me ask a question then, if it doesn't need to know. Yeah.
Yes, you ask the question. If it's the same, you don't need to.
It's okay. So let's go down. Let's go down to where?
Just go randomly to all the questions and just change any answer you think should have changed by now. At this point now, confirm diagnosis of STI and HIV is going to be correct. So scroll down. Yeah, the answer is still yes, because she's pregnant. Perinatal exposure question is still yes, because she's pregnant. Then confirm diagnosis of STI at the time of HIV vaccine, yes.
That would have changed. No. I previously been diagnosed with HIV, no. Condom use. She started using it. The new person she started to, she used it.
No, she didn't use it. That's why she got the HIV from him.
Yeah, what you say? She had a new partner, no?
Yes, from the new partner, she got the HIV, according to the story, right?
Okay.
So that means she didn't use the condom. So, I think the rest remains the same, and you save. You click on OK.
Are you seeing the other thing that's hanging on my screen, Mildred?
No, the tab covering it. It's only you that will be able to see it. You have to shift it to the bottom.
All right. Yeah.
So it saves. So keep scrolling down. You will see a button there that says Start Risk Reduction. Go up. Go up.
Oh, where, sorry?
Up.
This?
Keep scrolling up. No, up. Now see Start Risk Reduction.
Start Risk Reduction.
Yep. So you click on that, and then you already have an ID, so you're on her page already. It has your name as a counselor, and then you want to put the date, and then talk about the risk reduction.
Okay, clients will talk about HIV concern risk to partners and friends. Yes. Client plan to discuss HIV testing with partner and get them tested before having sex. Client plans to change or stop seeing high-risk sexual partners. Clients plan to change certain type of sexual behavior. Client plan to stop alcohol, drug use. This, yeah. Try to decrease admission and use of sex. Okay. Client plan to increase condom use. Yep. Order plan. Client receive pre-test counseling. Yes, they did, right?
Yes.
The client receive a post-test counseling. Yes. So yes, so because she's HIV positive, that means that date might change the day she received the counseling.
Yes, the dates would have changed, but that's that we.
So let's say it was the 9th of. It would record November.
Yeah, it's a record.
Pamphlet given, no. Condom accepted, yes. Number of condoms given, 9. Number of male condoms, yes, no. I want to switch on the female condoms.
Is that?
So number of condoms given.
So one is female, the top one is female, bottom one is male.
Okay.
So your risk reduction has been done. If you come to the pages menu and you scroll down to prevention, control, and PMTCT at the top. Yep. Now look at the options there. You can track risk history if you want to review the different risks that has been put there. This risk reduction form you just filled, you can actually the last one, yeah. Get that? So you can see the risk reduction history. And the screen is small, so you see it on the table. and everything that was filled in. So you can see the risk reduction history. You can go back to the same part. Prevention control. And then you can look at if these clients or if there are referrals for PrEP or PEP, if it's done in the country, then you can click on that PrEP/PEP referrals to register them into that care to be able to prescribe or give those medications. Scroll down again. Then pregnant client registration and PMCC data form. So she's pregnant, the system automatically referred her for PMCT. So if you click on get list, you'll see the list of all the referrals.
Oh, okay, so I don't need to I just need to get the get list, yeah?
Yeah, click on get list. So it makes it easier for you. And then you see that and click on form. And then it gives you the PMCT data form where you can now enter the information. So at this point, the estimated gestational age on this scenario is 26 weeks. And the estimated date of delivery that we had was April of, when in April? I think it was April of 2025, April 2025, maybe 8th of April or thereabouts. Then the health center, the district. The name of physician. So if the syphilis is already positive, as the treatment commences, they say no, not yet. Number of children under 15, no. And then save. Okay. So the prevention part has been done. You can now go back to the collect information form. No, go to scroll back up. The general population counseling and testing, and collect client information. And you enter the unique ID. Now she has said in the scenario that she has a new partner who is John. She brought John in for screenings, and John is also HIV positive and has tested and reactive for RPR. So we want to scroll down to contact listing. So here you don't need to list contact because she brought in the person for screening. In the event that the person is positive and they don't want to bring in the person, but they want to list the contact, this is where you list. But in the scenario, she brought in the John for testing. So you go to antenatal/maternity routine follow-up. Scroll down and come to partner screening. Yes, then below it there's a form. Scroll down and then you enter the date. It's already there, don't worry, your screen is small, so it's not showing.
Contact of reporter.
Yeah. Personality type. So you want to put the first name of the client is John. We don't have a last name. So fill in unknown for where we have no value. So John is 25 years old, which means that John was born in 1993. No? 2003.
2003, John.
Yeah. It's 2003. Let me see. No, if he's 25, it was born in 1999. Sorry, 1999. Mother's been feeling unknown for all those values. Mother's maiden name, you have to have a value. Unknown. Then go back up to the last name and put unknown. So unique ID, and then the type is, they just use order and create account. So the most important thing about partner screening is that you must create the account of the partner under the antenatal record for the pregnant person. Then you can now retrieve the information here and continue with collect information. So retrieve it. No, it's okay. You're on the correct form. Yeah, just fill in the form you have. Yeah.
So Mildred,
Yeah.
we knew about this partner in connection to this pregnancy.
Yeah.
But sometimes you can have a referral who you may not know would have been connected to a pregnancy. And so what would be wrong if you went and created an account for that person in the original system outside of that pregnancy?
Nothing will go wrong. It will save correctly. But what is going to happen is the part of the tracking where you want to know if a sexual partner is at risk, and that puts the pregnant woman at risk, that link will be broken. So if the person already has an account on the system, you still fill in that form. And if the unique ID already exists, it just attaches that as the sexual partner of the pregnant person without creating a new record. And so you can create the account on the main system and use the unique ID to fill the form on that partner screening.
Okay, but when that person comes, they may not know the unique ID of the associated pregnancy.
Yes, so you only fill that partner screening form when the partner is at the clinic.
Okay. I got it.
But if not, if somebody just shows up for screening and maybe was part of a listed contact or referred, you will have it on the contact listing page that this person was listed as a contact for a pregnant person.
Oh, okay.
So you have to, fill this form first. Fill the form you have on your screen first.
Yeah, I did it.
Maybe the unique ID you entered, was it correct? So put the record access there. Okay, so no record was found for the unique ID entered. Go back to the antenatal.
The unique ID, Lester, you put a 0 instead of a. You use a 0 for October. Don't forget the F.
But there you use 99. Yeah.
And you use a 0 for October. Is that a 0?
Yes.
But
no, it's for the guy. It's for the guy. It's not for the girl.
I know, but you use a 0 instead of October. Check and see what the unique ID is. Because it's not finding this unique ID, so there's something wrong with it. Another way you can retrieve the unique ID is to go back to collect information and enter the unique ID of the pregnant person. That's the JUU09F and October.
I mean, it can be in small caps, right?
Yes, it can be in small caps. Okay. And then down and come to antenatal, so maternity routine follow-up. Scroll down. Go to partner screenings. Scroll down. And look at the unique ID you have there.
Yes, it's an O I put, not a 0.
Yes,
a
so
0 I put, not a O.
A 0 that one. So copy it.
Wasn't it 01?
Yeah. Okay.
Wasn't it 01?
Yeah, it was 0 I put, not the O.
Okay.
See, it's a 0 right there for October.
01 pregnancy.
Yeah, the 0. The guys, the partner's unique ID, I didn't put a O, I put a 0. That's why I'm having an issue.
Yeah.
Okay, so let me get it. It's okay. I will. So it's JUU 99M 0C. And that's why I have it. So this is correct information.
need to request release of the file first.
Request for this there?
Yes, we have to fill that form first. You got a success message, so collect information.
There we are.
Yes.
Voila.
So now John.
Start the process, yeah.
Yes. So now we enter John's information. Nothing was given about his personal information apart from his age. And have his screening results to be HIV positive, the syphilis, RPR was reactive, the titer was 1 in 128, and also positive for herpes.
So you do collect all the information, Mildred, or?
Yeah, you collect you have to skip this form because there's no information here on the scenario.
To skip it?
Yes. Go to risk factor form. No, on the other tab. Just scroll back up.
Oh.
So in a real life scenario, you won't skip that form because the person will be in front of you and you will have the information you need. So the risk behaviors. Let's
go. Okay, so you haven't done the test, right, Mildred?
So the scenario said he has done the test and is positive for HIV and also for syphilis.
So which ones are you doing normally? Two of them, actually.
So the scenario said it was RPR that was done. And yeah. And the titer is 1128.
Where are you recording the titer? Oh, one in what?
128.
Other screenings are now contact listing extra notes.
Yeah, you do other screenings because he was positive for herpes.
Yes, sir. For herpes too?
Yes. I don't know if there's herpes on the list. Scroll down and see. If not, we'll just keep it. Okay, there is after CBC at the top. At the top, you see pregnant. Yeah, after CBC, there's herpes. No, go back. Just after CBC, you see herpes. Back to top. Yes.
We have it. Enter others.
Okay. And then you can do contact listing, but the scenario did not tell us about contact for this person, and you want to do the referral. He's HIV positive. Also, you filled the ELISA test, right?
Yeah, he's confirmed.
Okay, so now you go to the referral tab. Pages.
We need to do the for the HIV.
Yes, HIV.
For the ELISA, yes.
For the ELISA, yeah.
The thing is, most of us are going to start doing serial testing. So the confirmation test we're going to use is
the second test.
Yeah, it's one of the other tests.
Okay. Lester, it's like you're very tired. You've gone one day into the future.
Oh.
You have to fill in the months. Once you've changed the day, the whole month and year will reset. So you are saying if you use 2 test kits, you don't have to do the ELISA test?
Yeah. So what we're gonna, I think most of the Oasis Islands are moving towards, and I think most of my counterparts will mention that we're gonna use just the determine for testing and the unit goal for confirmation.
Okay. And so once it is
instead of having to do send the ELISA up to the lab,
But would that be accurate though?
Yes, because it would have been validated.
Okay.
So instead of having to do the parallel testing, we do our confirmation for our clients, especially if they have been tested in a rapid testing site, one time for them.
All right. But don't you have situations where HIV, the test kit will be reactive based on other conditions that the client has?
No, because the determined kit is very sensitive, but the Unigold kit is very specific.
Okay.
So if I get a thin line, for example, for some hormonal stuff for a pregnant woman on the determined kit, and I do one with the Unigold and it doesn't show, then it means that it's just because of other things. The sensitivity of the kit is very high, and that's why they are using it. They're using the Unigold, which is very specific to what we are looking for confirmation.
Okay.
It's been tried and tested, kind of, so it's something that we just have to adapt.
All right.
All right, there we are.
Okay, so now you need to refer.
All right, so that's the referral. On this side?
Yes, so you go to referrals.
Psychosocial support?
No, referrals. At the top, just after.
Referral. Okay.
So now you refer new.
Here.
Administration and management.
Alright, so referring that person from here.
Okay, so referral is successful. Now again, the scenario said that Josette has gone back to the baby father, Philip, after she has been positive. So her other third visit, she is now back with Philip, and she was encouraged to tell Philip about her status. There is no past that says that she was sexually active with Philip, or that Philip is now positive. So we want to list Philip as a contact, right? Or let's assume that she brought Philip back into the clinic for testing, and Philip now is going to be our prevention sample. So we will create an account for Philip and refer Philip for prep. For prep, right? You do prep within the countries now, right?
Some countries are not sure, no? We've not started giving prep now. But we can use it for teaching purposes. It's absolutely no problem.
Okay. So you want to go to general population counseling and testing, and create a new account for Philip. Because here she has not, we might go back to her, just collect information, and since that Philip is the father of the baby, is a partner, so let's create his account under her pregnancy account, so that we'll have the two links of the two. No, not here.
Where? Under her antenatal.
Yes, go to collect information. So once the person is a sexual partner of, go back up to the top, general population counseling and testing, collect information. So if the person is a partner of a pregnant person, and it was during the pregnancy that the person is being screened, you want to create the account or list that account under the partner notification service. You didn't put the F. JUU09F. Yeah.
That's her, right?
Yes, that's her.
That's our index client. Yes.
Mm-hmm.
JUU09F October. Yes. Correct information. Right. So what you're going to do now, we're going to
go to antenatal and maternity follow-up.
Alright.
And look for the partner. Scroll down. Yeah, partner notification service there.
And now we're going to create an account for Philip, no?
Yes, for Philip.
So, start what we want. It's Philip, right?
Yes, first name is Philip. We don't have.
Give a code, man. It's alright.
They're both unknown.
As he made boyfriend, so she gave us his full name.
Okay. And then so let's say her and Philip are the same age.
She give her the same age?
Yeah.
Philip? What year was she born in 2009?
2009. We just use 1st of January, so just put anything. And he too was born in 2009, so he won't be arrested. Oh, but then John is 25 years old and she is 15. Right?
Right, but Philip is a different age person, yeah?
Yeah, so let's say Philip.
Give a younger person.
Yeah.
She was born in 2009. Let's give Philip 2010.
Well, Philip younger than her?
Yeah, well, 2010 would make him. Oh, yes, no. 2010. Let's make him a little older.
No, but 2015 will make him younger.
Huh?
You put 2015, which means he'll be younger. So you have to put 2005.
Wait, to go back a bit upside down. 2002, for example. I will make it now. Male. I give my African surname.
Ay.
Alright, so we give him a unique ID. Okay, let's give his passport number RO07769. As his unique ID, yes?
Okay.
And this is passport. International passport. Let me note it somewhere just in case.
Okay.
RA02278. Okay. And we can create an account for it right now. Alright.
Okay. So now you can request release.
HIV screening.
Yes. Put no for TB. You have to collect information. Did you refer John?
Did I refer him?
Yes.
Yeah. Yes, I think we referred him. Yeah.
After this one, then we'll check if it's referred.
and we can start with personal information and stuff, yeah?
Yes, but we have no information about Philip apart from that he's a baby father.
Yeah.
So we can make up something about him, and there is no screening information about him actually on the scenario. So we might want to, let's just give him positive and refer so we can have a lot of positives for the clinical management. So just make up anything and fill in any information. Successful.
The thing is, I have something on my screen that keeps messing me up.
Okay.
But, yeah. I'm trying to move it, but it's not moving.
So yes, clever. If the clients do not know the name of the partner, you want to encourage them during their next visit, if they can find out and list the partner. If the client is positive, the partner is at risk. So you don't know the name of their partner, and you might need to find out this information when they come back to clinic the next time, or encourage the partner to come in for testing. So you will not be able to create an account if the partner is not there.
So what's the next move now?
So the screenings, let's just try to make him positive, although the scenario did not talk about Philip. Apart from that, he is a baby's father.
So we made it positive, yeah?
Yes.
Voila. So now, syphilis 2 or just for HIV?
Or HIV.
Alright, so maybe
I want to refer.
So where you go now?
They want to refer Philip also.
Refer him?
Well, yeah. You said you referred John, right?
I think we did, yeah.
So refer
for new HIV case of yes.
Yes.
To refer for new HIV case for care registration management, yeah?
Yes.
Yes, we did. We referred the guy before.
Okay, so the date of referral.
The ID was
RA
022789. And
category is
adult, yeah?
was it not adolescent? You put him less than 18, right?
Oh yeah. Voila.
Okay, so your job is done.
I can stop sharing my screen.
Yes, so anybody from clinical management can now take over.
Dr. Nesbitt.
So who will share? Dr. Nisbet, Dr. Peter?
Okay, I'll share.
Now that the person has been referred, if you come to care registration and initial evaluation, normally maybe a clinical care nurse would have done this, but let's just do it since it has not been done. So we want to, you can view HIV care referrals first to see the list of those referred. You have to log back in.
Yeah.
So you go back to pages and go to care registrations and initial evaluation and view HIV care referrals. Now you can see the referrals there. So let's start with the female. You can copy the unique ID if you want. No, the first one.
The first one, Agnes Brown?
Yes.
Okay.
Oh, no. Yeah, okay. No, I think we didn't even refer the pregnant person yet. Okay, let's start with Agnes Brown. And then you come back to pages. Go to care registration, initial evaluation.
And then
so go to HIV care registration, adolescent adult. Is there?
And then
click on that. Yeah. Reload. Looks like your network is slow. Yep. So put in the unique ID there and get registration form. Now you enter the day, just the date you need to enter.
Okay, so that will be today, the 15th of October.
2024.
Okay, register.
Let's do an initial evaluation. You go back to pages, scroll down to care registration initial evaluation, and then scroll down. Scroll down.
Here?
No, keep scrolling down. So you've already registered, so the next thing is to click on adults, pregnant, and adolescent initial and clinical evaluation. That one.
What? Something's wrong with my network this morning.
Yeah. So enter the unique ID.
Yes.
Then now you want to fill in the enrollment information.
Okay.
Positive, let's just use today's date. Now the first one, the date confirmed positive.
And date of enrollment, today's date.
Yes.
Okay. She's 29 years.
So this is another case, not the one we filled in today. So we use this for practice, and then we use the other to fill in this one.
Okay. Okay, so this isn't one of the case scenarios, no?
No, this is one of the case scenario.
Okay.
This is the trial. Then you submit if this person doesn't have a prior art or regimen or start date, just submit.
Okay, none. Okay. So we go down next to her
baseline information.
Baseline information. So has she started art?
No, so let's assume we are putting her on art today, right?
Okay, so we're going to put today's date. It's okay. Her initial weight. Any weight?
Weight.
190 pounds.
You can convert to kilograms. Okay. The initial clinical stage.
What stage is she? Stage 2? She has any?
This one is something we're making up on the fly. We're not using the case scenario on this.
Okay. Alright, so stage 2.
So name of treatment supporter or medication pickup if you know.
Okay. Any name? let's say her dad.
Okay.
Home-based case provider, her same dad.
Yeah.
Drug allergies. If he has no allergies, so nil. Okay, and then submit.
So Gleba, the reason for system failure is when a particular required field is not entered or not entered correctly. So system failure messages are messages that are generated based on the data itself. If the data is not going to be accepted by the database table, so the error you always get is system failure. Sorry, I was responding to a question in the chat.
Yes, I realize. So go ahead and complete this one.
Yes. So the classification of that, scroll down to see the form to fill. If the client has had, if you have already done the clinical staging, you can fulfill this form. If not, you come back later.
Okay, so we said that clinical is a stage 2.
Yeah. So if the stage 2, so you can put the date of first stage to there.
Okay. That's it.
Yep. Submit.
This is small. I want to make this a little bit smaller because it's all over my press.
You want to make the screen smaller or the turn on the tab?
I want to make this bigger now.
Okay, so use the square box at the top.
It's hidden.
At the top right there, you see a square box for maximize. No, top right.
The thing is that it's hidden.
So something is covering it?
Something is covering it. I'm trying to get.
Oh, okay.
I'm trying to get.
Can you move that down the tab, the share tab covering it?
Move this one down. It's
Yeah.
down. Well, it's down. It's directly under there, but it's missing.
Okay. So if the client has a CD4 test today, you can fill the information, viral load information. But if not, if the client is going to have a CD4 test, you can fill in the date. You might not have the
date is done.
Yeah.
The date is done. So let's say it's done today.
Yes.
So fill in today. Okay.
So
but the result would stay clear because I have not gotten it as yet.
Yes. So just put in the date here. The date of today.
Okay.
And then you save.
And then you save. Okay. Submit. Okay.
And the viral load information.
So the viral load.
You put the date also. If there's
today. And then today's date.
And then you can just submit since there's nobody.
Okay, submitted.
So you are finished with the initial evaluation.
Right.
Ladies, scroll down. You can now go to psychosocial support or adherence counseling tab, and you can schedule counseling appointment. And then you put in unique ID in.
So can we click 2 things?
No, just one.
Okay. So what we're doing, adherence readiness or counseling, psychosocial support.
We're doing adherence readiness assessment.
Okay.
So you cancel at the top.
Cancel.
And adherence readiness.
Okay. Okay.
Now then you go back to the tab, counseling. Scroll down.
General population. Counsel.
Yep. And then start counseling. The counseling encounter. Start. The third one. Yep. Enter the unique ID. Go back there. The pages.
Go back to pages.
Go scroll down to psychosocial support / adherence counseling. Look at pending counseling appointments. You didn't click on that?
Yes, I don't know why the computer seems to be slow.
Okay, so go back to
psychosocial.
Do a new scheduled counseling appointment. Schedule the counseling.
Go to new.
Schedule counseling. Yeah, that one.
Okay.
And then enter the unique ID.
Paste.
Adherence readiness assessment.
Adherence.
Okay. Okay.
Client has been referred for counseling. Okay.
So go back to pages.
Pages. Pages, psychosocial support and adherence counseling.
So let's look at the pending counseling appointment.
Okay, so going to pending counseling appointments.
So you have it there.
There it is.
That's encounter. Pages.
Go back to pages. And then
and then you go to start counseling.
Counseling encounter. Okay. So
you have
I have it now.
Okay, so you scroll down and you see all of the pre-treatment counseling form.
Okay.
So you can make up any value.
Okay, how many sessions of patient attend? 2. Has the current treatment sufficient? Yes. Does the client have misconception about ARVs? No. Has the client disclosed his status? Yes. The person disclosed to. Do I just put like her dad, or do I have to put the name?
Anyone.
Okay. Is this person supportive? Yes. Has partner been tested for HIV? No. Is partner taking no, she doesn't know or no. Does client have children? Have they been intensively counseled? Okay, so she has Does client have children? Yes. Have they been tested? Then that would be no.
Yes.
But here is only one answer that can go. She can have children and the children are not tested. So does client have children? Yes. Have they been tested? No.
You fill in the box beside it there.
Okay. So child. And
so maybe you say client was advised to bring in children for testing.
Does the client have a treatment assistance? That would be no. Or would her dad be the assistant? That is the support.
Yes, let's say yes.
Okay. Treatment assistant contact 255-6666. Okay. Did the treatment assistant take part in the treatment adherence sessions? Yes, in one.
Yeah.
Does the client wish to be visited at home? If yes, no, doesn't want to be visited at home. How will you describe the client's mental status? A little bit anxious. Does client fear discrimination and violence at home or in the community? Yes, in the community. Who does the client go to for support at home or in the community? She only has one support at her dad. Does the client come to the clinic on his or her appointment date? Well, as the second time, I don't know. Yes. Has the client been adherent to other medications in the past? Unknown. Did you plan a job timetable with clients? Yes. Is the client a member of a care and support group? No. Substance addiction? No. It says no. Not applicable. Does client feel confident about taking or giving chair medication every day for the rest of life? No, she's not. She's anxious. She's not so sure she'll take it every day. Who else takes care of child other than the caregiver present? You can help her.
So you skip it since it's an adult.
Oh, here, okay. Has caregiver been trained? So that would be skipped also because it's relation to the child, right? Has client had any challenges taking other medications, TB, whatever, every time at the same day? Unknown. Does client know the names of ARVs to be taken and the time? Yes. Does client know the side effects of ARVs? Yes. Does client know the consequences of not taking ARVs every day for life? Yes, that was online. Yeah. Is clients on other medication other than the ones prescribed by the doctor, include traditional herbal medications? No. Assessment of client's readiness to start art. The patient is ready to start art. Client's questions and concerns.
If there are none, you can just keep that.
Okay. Other issues and notes. Okay, for now, no other issues. But no other issues for now.
Okay.
So that's okay. Alright, so it's been saved. Next step. So we go back to pages.
Hold on, it's not saved yet. Click on save.
Save.
Okay.
Okay.
Ready to save. It's not yet saved. Just hold on.
Not yet saved?
Nope, it's not yet saved. Yes, now it's
okay. I have to wait for confirmation. Okay.
So now you have to go scroll down. Now you have to go to appointments and patient monitoring.
Appointments and patient monitoring.
And then scroll down. And then you schedule clinical management appointment. No, the top one. Yeah, that one. Schedule. Yeah, that one.
Okay.
And the reason clinical management.
Clinical management. So the day of the appointment would be today's date. So we're scheduling an appointment. Okay. With confirmation.
Yes.
Gosh, this is so. Why is it's taking so long to confirm?
I think the network is. Click on the button again and okay. Yes, success.
Okay.
Then now you can go back there, go to patient appointments and patient monitoring, and create visit. Scroll down, and then create visit or record vital sign. Enter the unique ID. Now you record the vital sign. So make up one.
Okay, it's the temperature. 35.7. Blood pressure 120 on 7C. A pulse of 85 beats per minute. Respiration 18 per minute. Her weight 190 pounds. Her height 1.71 centimeters.
Is 171 centimeters?
71 centimeters and convert to meters. Okay. So her BMI at that might follow.
Click on the meter. The meter. Yeah, click on that.
Click on that.
On the 1.7. Click on the box of the meter. Then click back on the BMI. It will calculate itself.
Ah, great. Okay.
Yeah.
Great. 29.9. Okay. So that's it for her.
Yes, send.
Send.
Okay.
Okay. It's okay.
Now you go back to pages. Hold down to clinical management and then click on HIV care card.
Okay.
And enter her unique ID. So the process is somebody is referred, you register into care, you do the initial evaluation, you do the support counseling, and then have an appointment for clinical management, record the vital signs, and then you can access the care card.
Okay.
So that is the care card now.
Okay.
Scroll down. And then you have all the tabs for the different things. So the vital signs you recorded is there at the top.
Okay.
I said there's a child nurse that's registered that took the vital signs and you want to repeat it. The first tab allows you to record a new vital sign. So if you scroll down.
So that this one?
So scroll down. And you have this rolling. So you can record a new one if you want. If not, if you're okay recorded, you can go to adult or adolescent symptom review.
Okay. Present complaint. So let's see. Respiratory crash. No other comments, detailed findings. So that'll be a generalized maculopapular rash. Okay. New UI, other problems. So skin problems, including rash, that is not KS. Family planning, is she on any family planning? Yes, she's using injectable. Patient's disposition. What would that be?
Not applicable.
Okay. Assessments. I put symptomatic because of the itching.
Yeah.
Or should I put it as an opposite? Okay. Plan. So whatever we're going to do for her today, we put it in here.
Yes. You can put both symptomatic and opportunistic infection if you want. You can select more than one.
Okay. X-ray. A screen for TB. Adherence counseling.
Yeah, we did that.
Already been done, so I no longer have to put it, right?
Yes. So, Mr. Williams, this form is for doctors. Everything under clinical management is just for doctors. So for the nurse, it's just the part of initial evaluation, and after that, or down to the pre-visit. Then for clinical management, it's just the doctors.
Okay.
So you got a success message? So you can select the regimen. You choose the ARV therapy that you want to. So you want to start new treatment, and then
I have to type it in.
no, is there? You can select one. So
Oh,
if you can add it. The supervisor can now add whatever is not there.
okay. Okay, I added it.
Okay.
Save.
Yes. Okay. Okay.
Okay.
I can go back, scroll down. On the same page.
Oh, on the same page. Yes, there's different tabs. Okay. So then,
TB symptom quickly.
okay, so TB symptom checklist, 15th October 24. In the last 12 months, have you had any of the following symptoms? So she has had no symptoms. So no, I have to choose no.
Yeah.
No. Oh gosh, this is time. This is going to time. No. No. Chest pain, no. Fatigue. Yes. She raising her children on her own. She was tired, no. Unexplained weight loss, no. She a little bit obese. Overweight. Has it been previously diagnosed or treated for TB? No. Has it been in contact with a person unknown? No. Yes to one or more questions. Okay. Suspect or not suspect? It's another suspect.
So not refer for TB screening, you can say no.
Refer for TB screening?
No.
Then no.
Refer for chest x-ray? No. Oh yes? It was part of the plan, right?
It's part of the plan as the general plan. So do I have to put it there again?
Yes, put it there as yes.
Okay.
For TB treatment, no. For any prevention therapy?
None.
No, see.
But all our TB patients are screened for TB. All our HIV patients are screened for TB anyway.
Right, yeah.
So put yes.
That's it. Click on OK.
Okay.
Wait for confirmation.
I find it taking a little time. And what? Let me press it again. Save. Okay.
Network is slow.
Save again. Okay. Okay. So we go down. We keep on scrolling down. So update CD4. We don't have a CD4 and viral. Or do you want me to update it?
Yeah, you can make up one if you want, or just for the purpose of going through the forms.
Okay. So most recent, the date would be today's date, the 15th of October, year 2024. CD4 counts would be 450.
For the viral load?
Viral load would be 40,000. Okay.
Let's see.
Okay.
So we have the clinical staging form. Next.
Okay, but I'm not seeing it on the.
So you have to click on save.
Yeah, I have to click on save again. Okay.
Always make sure you see your confirmation. If your network is slow, it will just be slow.
We start doing this at the clinic. We can only see about two patients a day.
Yes.
That is at the beginning, the initial entry. Okay, so you said the next step will go to the adolescents and adult clinical staging.
Yes.
So the page today is the 15th. It's October. Yes, the state everything is being done today.
You might want to connect your laptop to charging.
I might want to connect it to
charge.
I might want to connect the laptop to what?
Charge. Your battery is running low.
The corner.
You finished?
Yeah.
Okay, it's good. Okay, so clinical staging, stage 1, we put the date already, 2024. 2024. Persistent general unexplained recurrent. We said she had an itch. Okay, so we said that's all she had. So save. Okay.
Then we have the next tab.
Okay, and then we move on to the next tab.
Yep.
The next tab.
Advanced drug reaction. She has not started the drug yet. It's today. Mental health assessment or evaluation. I don't know how you do it within the country. Do you do the mental health assessment before treatment and then during treatment to compare, or only when the client is on the ARV?
Well, it should be at the beginning, before starting treatment. It should be done, and during the course of treatment.
Okay, so you feel mental health assessment or evaluation.
Oh, that is one long form.
Yeah, you can look at the form and skip it and do it later.
Yes, and later.
Because we just look at the different domains, and in the last 2 weeks, how the ratings from how much the ratings from, I think, from 0 to 4, how much times or a day, how many times in the last 2 weeks, or how many days in the last 2 weeks has the person felt different symptoms. And then if the domain score is higher than a particular threshold, you want to refer to the psychiatrist, right?
Okay, yes.
So that's just everything about the form, just to get the domain score for each of the different the 50 domains and know what referral you are giving in case there is any of the warning signs for the client.
Right. Okay.
Then you have the treatment.
But we only started treatment today.
So yeah, you want to put whatever you are putting on the prescription, you want to fill it in here.
Okay.
Then put the frequency or whatever under the note. And then save. And if there's another treatment you want to give, you want to select it again.
Okay.
Hold on, it's not saved yet. Once it's saved, it has to clear. We have to get a success message. So click on the save button again. So it's either your network or your system, something is slow.
Something is slow, yeah. Maybe have.
So go back to the treatment tab.
Treatments. So I won't be able to just put all of the drugs. I have to put in the drugs one by one.
One by one.
So the patient is on 10 medications. I have to put, oh my God. This is going to be too long.
So you see how long it is? It's because you did all the jobs of the nurse before you came there. Normally, all you have to start from is just the care card.
Okay.
Yeah.
Okay, so if the medication is not there, I can type it in.
So if the medication is not there, the administrator will have to add it to the list for you to see it.
Okay.
So that's why during the configuration, everything. So on your live systems, you should have an exhaustive list of everything. And if there's something you usually prescribe that is not there, you want to add it to the list.
Okay.
Just cancel.
Oh.
Because there was nothing.
Cancel? Majority said cancel?
Cancel because you didn't fill in anything. Yeah.
Oh. But what I would have given her, some Peritona if she, or some Bactroban ointment if needed.
Yes.
Or something anti-itch, because usually once they start the medication, the rash disappears, the itch disappears.
Yes, let me add that to the list for you.
But it's more like a symptomatic management.
Okay. So you said, what do you want to add to it?
Piriton.
Piriton. Okay.
It's Piriton chlorpheniramine. It's an antihistamine.
And it's always 4 milligram, right?
4 milligram.
It's on the list now, so if you refresh your page, you'll see it.
Okay.
So just refresh. Yeah, continue. Click on continue there. Can you see the continue button?
Yes, I pressed it already.
Okay.
I think I pressed it, yes.
So click on it again.
Oh, there's no one. Your screen sharing is paused.
So you can play back your screen sharing.
Are you seeing my screen, Mildred?
Yeah, I can see it, but it's paused actually. So look for where there's share screen and just click on play.
Okay. I went share screen.
You can resume or play. I don't know what you'll see there.
Resume share.
Okay, yes. Then click on continue now. Something is blocking that?
Yes, something is blocking that, and I'm trying to unblock it, but it's a little bit, it's not. Can I press alt something and continue? Because something.
And press enter. Enter key on your keyboard.
Yes, but it's not entering. It's not.
Hit your tab key. Let's see the tab, and let's see what it will highlight. Keep using tab until continue is highlighted.
Okay.
Click on anywhere on your screen outside what is blocking the screen.
It's not continuing. Okay, I'm going to stop sharing.
Yeah.
And I'm going to start sharing again. And see. Okay, whatever is there, it's not coming out. Let me see this. Okay, Mildred, it's stuck. You said confirm that you're looking for use information and returning to the page might cause any action it took to be repeated. Do you want to continue? I'm pressing yes. Okay.
So now go back to the treatment tab.
Okay, so treatment tab.
And scroll down. So you should have the everything on the list. Scroll down. It should be the last on the list now.
Okay.
Yeah.
Yes.
Other treatment.
One tablets. Every 8 minutes. Okay, so save. Okay. Waiting for confirmation. Save. Okay. Okay. All right.
Look at all the tabs there. It's not every tab you need for every visit.
Every visit, right?
Use the tabs that relates to whatever you're going to be doing for that visit. Look at all the tabs and see what the hepatitis treatment looks like, the syphilis looks like, to just practice with it.
Okay.
So, but the tabs are not all. So you're not at every clinic day. You're not doing all this work. So
all right.
Clinic day is mostly the symptom review and the treatment that you'll be doing mostly.
Okay, then noted.
All right. So once done with the clients, the next thing will be the pharmacy and central medical store that we'll look at. I think by tomorrow or Thursday. I think we'll be looking at them on Thursday. But that your own role is done. The job is done completely.
Okay.
I've seen these clients and there's another one waiting. You go back to clinical management and then you go to care card. Normally the nurse would have done the vital signs and all you do is to just go to clinical management and you see the list of everybody waiting and you can go to their cards one after the other. So you can look at waiting clients, you see the list of all those who are already waiting, the vital signs are taken, and you can follow the order of the people on the list.
Okay. All right.
So on this list, you have purpose of visit, HIV clinical care.
Stop sharing?
No, not yet.
Okay.
So on this, your list that you have there for waiting clinical management, you have the purpose of visit to be HIV clinical management. And that is why you went to the HIV care card. If the purpose was TB clinical management, you would have gone to the TB care card. If it's for other STIs, then you go to the other STI care card.
Okay.
All right. Thank you so much, Dr. Peter.
Thank you, Mildred.
All right. So does anyone have questions?
Well, stop share.
So the scenario we walked to today is case 5. You can all actually practice case 5 down to the screening and the antenatal part of case 5. You can just give yourself unique IDs, different unique ID. You can have several of the same names. The unique ID just has to be unique. And then we will walk through the referrals and all of the clinical management parts again tomorrow before we look at the remaining other parts of the system. So we have just tomorrow and Thursday, and we'll continue with the practicals and other cases. There are other cases you can also use to practice without clinical management: case 2, case 3, and then case 4. You want to practice how to register the clients into the system, create the accounts, collect information, and refer for the kind of treatment and for the kind of management the client needs. Case 5, 6, and 7 all need clinical management, so you can try out with them, and then we meet again tomorrow to continue with different cases. Anybody has any question, any concerns, any clarification before we end for the day?
Mildred, Avril, I was trying to do one, creating a new account for a client. I used scenario 1, and I realized that when I got to a certain part, I couldn't go back and correct, let's say the date, the birth date. So if the client gives me a birth date and then you realize it's the wrong thing I give you, I don't see where I can edit.
Yes, so security information, date of birth, country of birth, unique ID, the ethnicity, and the testing code, you can edit them. Once you enter them in error, the supervisor will be the one to change those information and the names of the clients.
Okay.
Is somebody with the administration permission, you will give the unique ID to the supervisor and they will update the date of birth.
Thank you.
All right.
And what happens if that person is not available?
You can just note it down and just make sure you send a request or that email for that update of the date of birth.
So Mildred, the unique ID can be any ID according to your country?
Yes, can be any ID according to your country.
So we can use the VCT unique ID that we have been using years ago?
Yes, you can use that.
Okay, thank you.
Any other question?
Maybe let me ask a question. I hope I'm not sounding stupid. You want to practice pharmacy for tomorrow, like practice it this afternoon. Saying that we have to go online and we have to go join the Zoom while you're online or while the meeting is in progress. How do we? I don't know. I'm a bit lost.
Okay, you want to practice the pharmacy?
Yes.
You have an account already?
Yeah.
You have the pharmacy permission?
You have the what?
You have pharmacy permission assigned. You can see a pharmacy drop down menu, right?
Yes, I saw it, yes.
So you have to mimic Central Medical Stores first. And first of all is to fill in the stuff for the Central Medical. If you have that menu, you fill it in. And you can actually use the manual on the page if you want, but we're going to look at that tomorrow. You can use the manual on the page to fill in Central Medical Store. Let me tell you what page it is on.
Is there anybody? I don't think we have any Central Medical Stores present on our chat. Is there anybody? I didn't see anybody from Central Stores.
I don't think so.
So I guess Mr. Guy will have to maybe follow up with that and ask somebody to join us tomorrow or Thursday.
Yeah. Maybe Jack. But you can go to page 126 and 127 of the manual.
So, yes, I have spoken to the chief pharmacist. I told her all she needs to do is have the other persons who needs to participate send me their email address, and I'll share it with Mildred. And then Mildred will send the email to them so they can come into the session.
All right. But Guy, I don't think is chief pharmacist. I more think is the store manager, because she don't know about the job. But anyway, see what happens tomorrow. That can be discussed on another forum. Thanks.
Mildred, what scenarios are we to work on?
Okay, so for nurses,
the one we did this morning.
Yeah, you can do the one we did this morning. For nurses, you can do case 1, 2, 3, 4, and 5.
Case 1, 3, 4, 5.
Yeah, and if you are a midwife, you can try case 6. Case 6 and 7.
You can try anything then.
Yeah, you can try anything then. But if you want to, if you are just a VCT provider, not in the health, maybe just in the lab or so, you want to just stay with case 2, case 3, and then the rest of them you can now work with case 1, 4, 5, 6, 7 to look at all parts of the system. So you can practice with anyone, but we are going to continue with case 5 tomorrow and also do case 6.
Mildred, are we gonna have a repeat of Thursday session?
Of Thursday?
Mm-hmm.
No, there's no repeat for this week's sessions.
Okay, so the pharmacy session, can we do that tomorrow? Because there'll be a pharmacy meeting on Thursday, so some of us will not be a central drug committee meeting on Thursday. Sorry, so some of us may not be able to attend Thursday's training. So if we could do at least the pharmacy part of it tomorrow.
Yeah, we can do the pharmacy tomorrow.
Okay, thanks.
All right. All right, any other requests, you can send me an email before tomorrow and I will respond. If you need an account or your account has issues, you can also send an email and I will respond. Try to send the email before 9 a.m. tomorrow and before the session starts. All right. So thank you everyone for being here.
Have a good evening.
Yeah, and I'll share the recording as soon as this is ready.
Thank you. Bye.
Bye.
Thank you. Bye.